Well, in tonight's Women's Doctor, a new study finds that moms who receive the whooping cough vaccine during their pregnancy give birth to infants who are better protected against that infection. The study in JAMA Pediatrics looked at the more than 57,000 cases reported in babies under 1 year old between 2000 and 2019. Whooping cough may begin like a common cold, but unlike a cold, the coughing can last for weeks, even months. Pediatrician Dr. Ashanti Woods at Mercy Medical Center says babies whose moms are not vaccinated are at the highest risk of getting sick until they're 2 months old and can get their own shots.
About 1,000 visits a year take place in the youngest of babies, often requiring an ICU admission where babies have to sometimes be ventilated.
Now, Dr. Woods adds that pregnant women should get the vaccine during each pregnancy between week 27 and week 36.